One of the most well-established applications for point-of-care ultrasound is central line insertion. But one of the things that people don't think about is how point-of-care ultrasound changes the procedure itself. So typically what we used to do in the days of the landmark technique was insert a finder needle with a syringe on it, and we would draw back until we got a flush of blood in the syringe, and then we knew we were in the vessel. And we would look at the color, and then we would take the syringe off, and we would see whether or not there was still flow out of the needle and what kind of flow that was, depending on how sick the patient was, to make sure we were in the vein and not in the artery. But taking that syringe off was often the point where we lost access to the vessel. So what we've learned with point-of-care ultrasound is that we don't need the syringe on anymore. We can visualize the needle as it's introduced into the vessel and see immediately the flow out of the needle. We don't need that plunger, and we don't need the disconnection of that syringe as another step that can cause problems. So use point-of-care ultrasound, use a finder needle, don't attach a syringe, and when you get flow back through the needle, you'll know which vessel you're in because you're watching it in real time. Add your wire and then confirm where your wire is to make sure you're in the right vessel as kind of a secondary confirmation. So point-of-care ultrasound not only has added to the safety of finding the anatomy, identifying the anatomy, but now it's actually changed the technique to make it more effective.